This is your wound care skill, and it's called damp to damp dressing change. So remember all your steps in the beginning, which we've reviewed with you before. So it starts off with step 4, actually. Remove the existing dressing. So you're going to need clean gloves.
Make sure your trash can's positioned close to you so that you don't have to turn your back when we get to the sterile field. Okay?
She's removing the top dressing, which is called an ABD. It's an abdominal dressing, but it's called an ABD, so don't pronounce it abdominal, or it's ABD. Use the letters. And so she's going to take that off and open it up. We're looking for any type of drainage.
So we're looking at the color of drainage, the amount of drainage, okay? And then you're going to remove your inner dressings, the old dressing, and as you do that, you're going to count, okay? So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Okay, so you're looking for the type of drainage: sanguinous, serosanguinous, purulent, okay, and the amount, because you're going to need to document that. Is it small, moderate, large? Okay, and then you're just going to wad this up, and then you try to, if you can, put your glove around it, but sometimes dressings are too big and you can't get your glove around it. If you can't, that's okay. Don't spend a lot of time trying to do that. Take your gloves off, throw them away, and then you would perform hand hygiene. Okay.
And then step 5 says, assess the wound,
Okay.
especially the depth and including all crevices and tunnels, and apply clean gloves.
So to do our wound assessment, you need to put on another pair of clean gloves.
And you're going to look for the appearance of it. What
Okay.
does the wound look like? The drainage, size. So you're going to measure.
Okay.
That's how we determine that wounds heal, is that they measure and they hopefully are getting smaller in size. Looking for depth and undermining.
Okay.
Sometimes there's tunneling that goes up beside a wound, and you can feel that with a cotton-tipped applicator. Any swelling, any pain, any drains or tubes. Make sure you can tell the faculty what maceration means, which
Okay.
is that soggy tissue around when you get wet dressings onto good, healthy tissue. Make sure you can tell them that it's granulation tissue that you're looking for. Nice, healthy, beefy pink granulation tissue. Make sure you can tell them that if it had yellow tissue adhered in the wound bed, that that's slough. And make sure that you can tell them that eschar would be a black, dead tissue.
Okay, so when you do your assessment, you're going to document things like numbers on a clock. So this would be 12, 1, 2, 3, so on and so forth. So when I'm documenting where the tunneling is, where the undermining is, I'm referring to it as numbers on a clock. So undermining at 1 o'clock or tunneling at 2 o'clock. So that way, that's a universal symbol, so everyone knows where to look when they go to look at this dressing. Okay, you look for maceration on this good skin, and that just looks like white, spongy. Okay, that means if you stay in the water too long, you know how your fingertips get white and wrinkly. If that happens on your good skin, that could also cause further breakdown and make your skin bigger. So if you're seeing maceration on the outside of your wound, okay, you need a different dressing because you're not absorbing enough moisture. Okay, so you do not want to see the maceration on the good, healthy skin. Okay, so part of our assessment, we have to measure. If you look on your cotton-tipped applicator, this particular one has numbers here, so we can use that as a guide. So I always get 2 of them, one to use as my measuring tool, and then the other one to actually put in the wound. Okay, we just do our assessment with clean gloves only. However, our cotton-tipped applicators are packaged sterilely, so if we're going to stick those in the wound, we want them to stay sterile. Okay, so just like always, we open our packages away from us. Okay. And then I'm going to take my cotton-tipped applicator, and 3 things you need to measure with your wound. You need to measure length, so that is going to be from head to toe. So you might need more than 1 cotton-tipped applicator because you might need to put them together and then mark. Okay, 1 whole cotton-tipped applicator tells you on your package is about 15 centimeters, I think, and then you can just add if you had to add on to that. Okay, so that's your length. Okay, then width is going to be from side to side, so you would want to measure that. And then of course you're going to take a cotton tip applicator and you have to measure depth, or how deep it is. Okay, so those three things you must include in your measurements for your wound assessment: length, width, and depth. Okay, then if there's any tunneling or undermining, you would stick your cotton tipped applicator and you would measure where the stick comes out. Okay, and then you would document as to where it's at on your hands or your clock. Okay, and then of course you're noting any healthy granulation tissue, which looks like red beefy hamburger. That's what we want to see. That means we're getting new tissue in there. Okay, the purpose of our damp to damp dressing change is
to keep the wound moist. We now know that moist wounds heal better. We used to do this as a wet to dry, so you may still hear people call this dressing change of wet to dry. With a wet to dry, we left it on longer so that it dried out, and then we would pull it out of the wound bed. And when we did that, evidence-based practice has shown that we are actually pulling healthy tissue out along with dead tissue. So now we do a damp to damp, and we don't let it totally dry out. We keep the wound bed moist. This is an inexpensive dressing that we do in home care, but there are lots and lots of fancy dressings that are chemical and different types of wound bed dressings that we can use nowadays too. But this is an inexpensive dressing when money isn't an issue. All right, so now she's taken her gloves off, and we're going to perform hand hygiene.
okay.
And then if required at this point, you would do wound cleansing, which there are wound cleansers, or we irrigate with a large 60 ml syringe. This is not required for this skill. So number 7 is prepare your supplies. So I'm going to open the packages of the sterile dressing set, packing in the bowl. And then we're going to pour the ordered solution into the bowl, which is going to be normal saline. And then she's going to apply her sterile or clean gloves, and then place the packing into the bowl and thoroughly saturate with solution.
Okay, so you're gonna need your 4x4s out of your bag, your regular package of your 2 gauze sponges for your dry, and then your ABD to cover. Then you'll need your tape. Of course, you guys are not gonna have saline at home, but if you wanted to practice, you could take like a cup of water and just practice pouring, because remember, we gotta watch things like splashing when we pour so that we don't contaminate our sterile field, okay? And then I've got my sterile gloves here when I'm ready. You wanna open all your packages before you get your sterile gloves on, and remember, you arrange them in the order that you're gonna use them so that you're not reaching over, okay? Your saline should be labeled. It's good for 24 hours, okay? If it's not, you have to throw it out and get a new one. So I'm gonna open all my packages away from me. And actually, these 4x4s, if you turn it around where it looks like it's upside down, there's a little part where you can peel that back, okay? So these are for my wet. These 2 are gonna be for my dry. And these packages, they don't open the greatest. Sometimes they tear. Just do the best you can.
Remember, you can touch 1 inch around the edge of your dressing packaging.
And then this one, it doesn't matter if you open it this way or you open it this way. And you're gonna wanna make sure you leave enough room in between so that when I use my arm to pull this over, I'm not going over my other supplies, okay? So you wanna have enough in between that you can do that. Tape we're gonna put on last, so I'm not gonna get that ready. And then remember, we wanna always palm the label. Make sure it's dated in time for less than 24 hours. If it's not, you get a new one. You're gonna take your cap off, put it right side up, okay? If this has already been opened and it's within the correct time frame, remember we have to cleanse the lip, okay? If it's a brand new bottle, you don't have to cleanse the lip, okay? So you're gonna wanna wet your 4x4s. This is your damp part, okay? Remember, don't take your bottle here because you'd be going over your sterile supplies. So you wanna be careful there. And you do not have to fill up that whole tray, okay? Because we're gonna wring them out anyway. So you don't wanna have too much saline, okay? They wanna be damp but not dripping. Okay, once I'm done with that, I'm gonna either put that on the end or you can put it off to the side, whatever you prefer. Now that I've got my packages open and my saline poured, you wanna do all those things before you get sterile because those are unsterile on the outside, okay? I'll put my tape here because I don't quite need it. Again, now I'll come to the end of the table and I'll open up my sterile gloves. And by now we should all be well versed in putting on sterile gloves. Remember, if you can't get your fingers in the right finger holes, just go ahead and get your hand covered. We can always fix that whenever we get our second glove on. Okay? And that will happen. Okay, again, make sure your glove package, if you're doing it on the end, is not touching your open packages. You can either leave it there, you can pick it up by the middle and throw it away, or knock it off with your elbow if you don't want it to get in your way. It's up to you, okay? So the first thing we're gonna do is we're gonna take our wet gauze, and I'm gonna wring them out because they don't need to be dripping. We need moisture for wound healing, but there's a fine line. If you have too much moisture, you're gonna cause maceration and it's not gonna heal. You'll cause further damage. If it's not moist enough and it's too dry, it's not gonna heal either, okay? So we wanna squeeze these out and make sure that they're not dripping, okay? And then there's 10 in a package here, so I'm just gonna fold these out and I lay them flat in my hand. Then I use my dominant hand to help me pack them into the wound, okay? And when you pack them, you don't want them packed too tight. You want to take your gauze, and we do kind of a little fluff because that allows the drainage to come up through all these little holes in your gauze. That's called wicking, okay? If you pack them in there tight, the drainage won't be able to get to the top, sits in the wound bed, and it will not heal, okay? So I kind of just fluff them out a little bit to allow drainage to go through those holes, and you're gonna pack them into your wound. As you're packing, you're counting the number, because when we document, we have to document the number of old dressings we took out and then also the number of new dressings that we put in. So there's 2, and you don't want to put the new dressings up on the good healthy skin because that will cause maceration. 3. And our hope is that every time we change it, 4, that we're putting less and less gauze in. That means it's healing. 5, 6, 7. Now I dropped that one, so you can't use it. And I'm gonna put just my last one here. So I only put 8. So your extra ones, you can either throw them away or you can gently put them back in your container. Don't toss them because it will splash and get your other supplies contaminated. Okay, so I've got 8 there. Then in your package of dry gauze, there are 2. So this is going to be the dry that goes on top. You just kind of set it on top there. Okay, and then lastly, we cover with our ABD. Okay, this is so it can absorb all of our drainage. The blue line goes towards the sky, okay? And the blue line is there so that it shows up on an x-ray. So if a patient gets an x-ray or something, this should show up as a dressing and not some kind of foreign object on their x-ray, okay? So the other side is plain, so that goes down to the inside. You want the blue line to the sky. And we just set that on top, okay? Once we get that covered, our sterile procedure is over. So if my gloves were contaminated or messy or I wanted to take them off, I could do that just to tape. Okay, so I'm gonna do that so I can tape. I would take my gloves off. If I had some alcohol hand rub, I would alcohol my hands. And then for taping, we're gonna do what we call window frame or postage stamp. You want it taped all the way from end to end so that it's covered, nothing gets underneath there. However, you can see we're gonna have to be a little creative because this dressing is gonna get in the way of this person going to the bathroom. So I'll show you how to do that in just a minute. And again, try not to use too much tape, especially on older people because you can tear their skin. So you want to use just what you need. So I'm going to put this one end to end here. Okay, I try to do the full sides first and then I'll piece in for the sides that we're going to have to be creative for the restroom. Okay, so I'm going from one end all the way to the other. Then when we get over here, we're gonna have to piece this in here because you cannot take a piece of tape and go around this corner. So you're gonna have to tear one piece and do your longest part, okay? Then when we get to this corner, you're going to have to fold this back so that it's out of the way for the patient to use the restroom. You're gonna have to tape it back there, but then we're also gonna have to tape here because if we don't, things can get up under there into the wound. So then I'll take a smaller piece, and you wanna put this at an angle because that's the way your line goes of your dressing, okay? And then lastly, we should just need a small piece for here. And then if you look at your dressing, you just want to make sure, follow it along with your fingers, that it's sealed all the way down and around on all sides so nothing gets up under there, okay? Your wound won't heal if bacteria and things are still allowed to get up under there. So you have to make sure this is sealed. And then lastly, you're going to take a small piece of tape. You would take an ink pen or a marker, write the date, time, and initials of when you changed it, and we would put it up here in the corner, okay, so that it's easily seen. You never take a marker or a pen and write directly on the patient's dressing. You will see this done in the clinical area, but you do not do that. These dressings can be painful, okay? So remember, before we go to take our old dressing off, it's always a good idea to do a pain assessment, and if the patient needs pain medication, you could offer them pain medication before you started this process, because this is can be really painful for these big pressure ulcers, okay? So once we've date, timed, and initial it, put our tape there. Then you just make sure your patient's comfortable, and then you're going to document all of your relevant information. You're going to document your assessment at the beginning, your measurements, what your wound looked like, and then how many dressings you took out, and then how many you put back in, okay, how your patient tolerated it,